The situation worse than ever. The nation recording its deadliest day yet in the COVID-19 pandemic, along with record hospitalizations. Southern California, along with Arizona and Rhode Island, among the worst places in the world right now in terms of per capita infections. Aaron McLaughlin has more from Los Angeles, where the countywide death toll now tops 11,000.
This morning, a grim new national record. More than 4,000 COVID deaths reported in a single day. Illinois, now the fifth state with more than 1 million cases. And in Southern California, hospitals are facing a crisis of epic proportions.
It feels like we're in the fog of war.
Harbor UCLA Medical Center says it's running low on ventilators and is almost out of dialysis machines. Military medics and nurses have been sent to help exhausted staff, while 2 refrigerated trucks wait in the back, needed to store bodies the morgue can't accommodate. A desperate situation as the fallout from Christmas is just beginning.
We are all planning for that worst case scenario 2 weeks from now.
Are there enough people available? Is there enough supplies available?
Time will tell.
The surge is also swamping funeral homes. Shipping containers normally used to keep food and other items cold are now being sent to store the deceased.
We're probably getting upwards of 10 calls a day just from mortuaries in Southern California. We are getting calls from Bakersfield, from San Jose, from Sacramento, from the Bay Area.
Are they doing this as a precaution, or they need these containers now?
They need them now.
Nationwide, 59% of all transmission comes from asymptomatic carriers, part of the reason why infections continue to surge. In Florida, a new daily peak, nearly 18,000 new infections.
We are in the fight of our lives for Americans in this country.
Despite the safety risks, recent nursing graduates like Roxanne Aguirre are stepping forward to help, inspired by those who've been lost.
My grandma actually passed of COVID a couple months after the pandemic started. Just knowing that she had to die alone, it definitely strengthened my want to be in nursing, because there's so many of these patients that are just dying alone.